You've been asked to view this video because you are considering having a vaginal procedure performed. So the first thing that I always like to cover with patients is I am going to be the one, Dr. Lawrence, who performs your surgery. A lot of patients recognize that sometimes in a busy surgical practice, there could be other surgeons or other assistants. It will actually be me that's performing the surgery, and I'll be bringing the experience that I've had over the last couple decades. So the very first thing I like to consider with a procedure that's a vaginal procedure or a labial procedure is the fact that it's a voluntary procedure. I want to make sure as your surgeon that there's no coercion involved, that this surgery isn't being done for somebody else, that it's being done for you. I also will go over your surgical plan in details to try to understand your goals. I understand your goals might be aesthetic, in other words, how things look, or it might be functional. You might want things to work better. You may want to increase confidence so that your life is better and your activities with your partner are more intimate and along the lines of what you'd like for you in your future. We will look at photos. The photos might be pictures that we've had with our patients, and those can be helpful. Although, because every single patient is different, it may be that your photos that you bring of you, maybe in different positions, or photos that you bring from other patients who've had a procedure similar to what you contemplate, those can be very helpful. We'll be willing to take time to look at all of those. I want to make sure in my mind that I understand whether this is a functional issue. In other words, you want something to work better, whether that might be just your intimacy, might be having something to do with the functions of orgasm or urination, or whether it's maybe just fully aesthetic. There's just something about the way you look that you want to be different. And I, as a surgeon and as a physician who cares about patients, realize that sometimes an aesthetic thing can give patient a lot of confidence, and it can be a decision can be made along those lines from a very healthy place. And that's what I want to make sure that it is coming from a healthy place. So with all procedures, I always want to talk about risks, and the general risks of having any kind of a surgical procedure include the fact that you could have bruising, swelling, color changes, and some of those could be short-term or some of them could be long-term, and we will talk through those in detail. I also want to make sure you understand that patients sometimes will have asymmetry. In other words, it's almost guaranteed if you look close enough, all patients before a procedure are going to have differences between the side, and it's even though we're trying to look towards symmetry, you're almost guaranteed to have some asymmetry. I want patients to kind of recognize that. And I just kind of want to know or have my patients understand that there is a part of this which is unpredictable. In other words, it could have an effect on you psychologically, it could have an effect on you physically, it could make your sex better, it might make your sex not better, and so those are conversations that we need to have and be really honest about it. I also want all patients to know that revisions are not always need to be considered. In other words, you might have to have another surgery, and then I also like to be really straight up about psychological risks. In other words, this might not give you the thing that you're looking for, and so we always want to really give some thoughts, not just to what's going on physically, but what's going on with you in your mind. The benefits are fairly obvious. We have a lot of patients that have benefited from this surgery or we would not be doing it, but we're willing to be really straight up about what we think the chances are after talking to you that you'll get those benefits that you're looking for. And the last thing I always want to say is that this is one of the alternatives is that you just not do this surgery. Do not feel bad about going through this process with us. And as we go through this process, you making a decision that you don't want to move forward with this. We really feel like it's our duty to walk through this issue of informed consent, and you can get all the way up to the day of the surgery. And if you decide that you do not want to move forward with it, it's always been our policy that we will give you a full refund if you change your mind based on the fact that you don't think this procedure is for you. So I hope that's helpful. Please feel free to reach out to ask us any additional questions that you might have.